Hello, my name is Dr. Matt Griswold. I'm the owner of 918 Chiropractic, and you're seeing this video because you probably were in a personal injury case of some sort. Whether that's a car accident or you were hit by a car, typically you're only seeing this video if you specifically were in a personal injury case. I want you to know what we're looking for and why we're sending you this video is I want you to know what to expect in the next few days. Depending on when your accident was, we know that if your accident was yesterday, within 24 hours, that you haven't even experienced half of what the inflammatory process or the injuries that you sustained may be. In other words, however bad you feel right now, I don't mean to be the bearer of bad news, but in 14 days it's gonna peak and that'll be the worst of it. We always wanna get you in before the peak so we can start to avert the peak of pain. I want you to know that ice is your friend, heat is not your friend. You wanna cool inflammatory process down, you wanna cut your sugars or reduce them if you can. These are all good things. Those ice is your friend, heat is not your friend. I want to be able to take care of you, but you have to take care of yourself prior to coming to the office by getting in as soon as possible, as well as anybody else that was in the car. If you feel like you should be checked out, then I'm going to tell you right now, whoever was in the other car or your car should be checked out as well. You see, it's important about now what we see, but more often than not, in my clinical practice, I see patients and say, when was the car accident? And they'll say 5 years ago, 10 years ago, 15 years ago. I don't want that for your spine. I am now responsible. If we've accepted you as a patient, I'm responsible for that. So I take that very seriously, as I hope you would want me to take it. I'm responsible for your spine because you and I are in a relationship as a doctor-patient, and I want you to get better. So as we move towards getting you better, I have to stick to some certain guidelines and rules that are laid out for personal injury cases so that we can make a clean case for you, for your lawyer, for your insurance company, any of those things. Please remember, number one, more important than anything else, is us taking care of you to get you as best as we possibly can. We have to get you at least as good as to where you were before the car accident happened. We call that pre-injury status. I gotta get you to the place of where pre-injury status, but I also have to get you to the place to where 15 years down the road, you're not yelling at me because your neck is still problematic because of a car accident. So I always wanna make sure that you're number one. Number two, we have to handle the business. The business is this. In a personal injury case, paperwork is very important and unfortunately somewhat monotonous. There's a lot of it. I don't make the rules, we just have to follow them. So I need you to be able to fill out the paperwork. You'll have a specialist that's on your case from my office that will be able to contact you. They'll help contact the insurance company. We literally have someone designated to your case to handle this on a per person, per case scenario, so you're not alone on this thing. But what I want you to know is that she's gonna ask you to follow some strict rules that we have to follow. Number one, the rule being, we need you to show up for your care. I can't continue a case or tell an insurance company the patient has injury if there's a break or lapse in care. 2 weeks is that amount. So if there's a 2-week break, longer than a 2-week break in care, we start to have a re-exam on the next visit. We close the case pretty much immediately. I need to make sure that if you are under current treatment, it is called active treatment, I need you to remain under active treatment. Another question we often get asked is, what is med pay? Med pay is something that you have on your insurance policy. You see, car insurance, even if you hit someone or they hit you, car insurance covers the car. Medical pay, med pay, covers the occupants in the car for any of the medical problems that they have. We will be billing towards your med pay. This will not raise your rates. This is exactly what that policy is designed for. It's designed